Welcome back. Continuing gift giving traditions, the organization MJHS Health System gathers volunteers to prepare holiday gifts for children receiving hospice care. Volunteers and staff hand delivered presents to pediatric patients and their families in the Bronx, Manhattan, Brooklyn, Queens, and Nassau County. Joining me now to discuss this effort is the senior pediatric hospice physician at the MJHS Health System, Dr. Damani Taylor. Doctor, thank you so much for joining me.
Oh, no, thank you for having me.
Now, to start it off, for those who don't know, could you just tell us a little bit more about your organization?
Sure. So, MJHS Health System is an organization that provides medical care in a respectful, compassionate, and empathetic way to our communities in the Bronx, the greater New York City area, and Nassau County.
Now, for those who don't know, can you just talk a little bit about the services that you provide?
Sure. So, we provide a range of services, anything from just general home care to nursing home care. Specific to today, I'll be focusing on our pediatric program.
And now, before we go into that, we're talking about people who are in hospice. For those who don't know, can you explain what that means?
Sure. So for patients in our hospice program, whether it be our pediatric program or adult program, it focuses on the care for people who have a terminal illness. For our adults, that can be people who have an illness with a life prognosis of 6 months. And for our pediatric program, that's usually kids with a terminal illness with a prognosis of less than 12 months.
Now, can you explain the difference from adult hospice and pediatric hospice?
Yeah. So, with adult hospice, we're talking about care for people who are dying, which, while a sad part of life, it's also kind of a natural part of life. Whereas when it comes to children, that's completely foreign. Parents aren't having kids with the expectation that one day their kids would die while they're still alive. It's often described as the worst thing that can happen to a parent. And there's no real manual for it, right? So what we are really hoping is to help support those parents. So in addition to the life expectancy difference that I mentioned before, the program also can allow in certain situations for children to continue therapy, like chemotherapies that's designed to hopefully cure the child. Whereas for adults, the care is really focused on quality of life care rather than trying to focus on any disease treatment specifically.
I'm glad that you actually brought that up because I think that just the overview you would just think of it as like a blanket, but it's nice that you guys have like specific care for specific stages of life. So I'm glad that you brought that up. Now, who is eligible for the programs your organization provides?
Sure. So to qualify for the pediatric program, you do have to have an illness, a terminal illness that you have a prognosis of less than 12 months. Also, it usually requires like the certification of a physician. And for our pediatric program, the age range is from newborns to young adults, especially young adults that are under the care of a pediatric subspecialist or specialist.
Now, you talked a little bit about, how sometimes parents aren't totally prepared, for this type of thing. What is the support that your organization offers?
Right, just like you're mentioning, when it comes to supporting a parent or a family and really caring for a terminally ill child, it really requires kind of a multidisciplinary, multifaceted approach. And so we offer things from, medical care, obviously, with, a physician or a nurse practitioner, nursing care with the assistance of a nurse, to other things like social workers who can really help support the families when it comes to not just what it is to deal with it, but also getting community resources to really help them find the things that they need to help them get through that experience. We also have bereavement for after someone dies to help people counsel them on what it is to live afterwards. We have pastoral care, which are really like chaplains that can help people who have spiritual issues or even existential issues for those who aren't necessarily religious. We have creative art therapists that offer like things like music therapy or for art therapy that is not only fun, but actually has like a therapeutic intervention that can really be helpful for people to get through tough times. We also have a volunteer program where people come and just hang out with the kids and just have fun. So
That's
there's a lot of things we
amazing.
have to offer.
I'm so glad that you shared that. I think that a lot of people, when they think of these types of settings, it's usually maybe gloomy. But it's so nice that, there are so many just like different outlets for a lot of the patients and their family members to kind of express themselves and, just kind of feel a little bit different. So I'm glad that you shared that. I want to talk about your most recent act of service, which is providing gifts to these children. Can you talk a little bit more about that effort?
Sure. Yes. Very very relatable. Sorry, topic right now. We're in the holidays, right? So our gift giving program. Yeah. So one of the nice things about this time of year is that we want to really share a really nice time with the kids. Not focus on the disease so much, but really a happy time. So our gift giving program is something where our staff dresses up with gifts that are donated through our Young Leadership Council in MJHS. And we go out to the families and deliver gifts to the kids during the holidays.
Now, can you explain how this effort actually began?
Sure. So about 5 years ago, the MJHS Young Leadership Council collaborated with the nurses and the social workers on our staff and to address the need that, a lot of the kids aren't really necessarily celebrating the holidays in a real meaningful way. And so they thought, well, why don't we help bring some fun to the children? And so, through donations, they were able to collaborate with the staff. We all got dressed up. We went into different houses, and it was really, really a fun time.
Now, I know this has just been a tradition for your organization, and it's very heavy volunteer based. What makes people come back every year, to provide this act of service?
Sure. So, for a lot of parents, they're so focused on giving the excellent care, right, for their kids. We have some really dedicated families. But, sometimes they're so dedicated that they kind of overlook the holiday, or they're so busy that they
Right.
can't really focus or plan for the holidays. And so really, it's really nice that we can do this to just kind of help people forget that, hey, like I'm dealing with this medical condition, and just focus on just having like a fun time. And for the staff, it allows us to not only feel good that we're help bringing that nice experience to the families, but also allows us to kind of step out of kind of like our clinical role, whether it's me as a physician, someone else as a social worker, and really just be as like one person to another, and really focus on the humanity
Mhm.
of our patients, and really in the enjoyment of what the holidays are.
That's amazing. My question was going to be, what does this program mean to the patients, their siblings, and their families? But you also talked about, what this could mean for staff as well. So I think that's amazing. Can you elaborate on what the program means to those families, though?
Yeah. So, when you're a family member or parent of a child with a terminal illness, you're often just so focused on the care, right? Care, their illness, what it is to, find money to do this related to the illness, or buy this related to that illness, what it is to explain it to family members, or deal with siblings and explain what's happening to them. So like your life seems so just caught up surrounding this terminal illness,
Right.
and to really have an event, right, that allows you just to be, mom opening up the gift packages, or dad playing with a toy with that child, right? It really allows you to kind of step away from just the focus on that illness so much, and go back to what it is to be a family, what it is to enjoy the holidays as a family.
Now, can you talk a little bit about the annual celebration of the gift wrapping party? Can you just tell us a little bit about that?
Sure. So, it was really a wonderful experience. We as a staff, come together, and, we, wrap the individual gifts for the kids and get it ready for delivery. But it's a really meaningful experience because we get to have a group that kind of shares the same goals, the same values, and talk about meaningful experiences with our patients and families. And especially now, I think this will be the first year since the height of the pandemic that we're able to actually physically be in the same room
Mhm.
together, which is really nice because a lot has happened, and it really, the camaraderie of the group together is really cool.
Now, I think this is super important. What are some considerations people should just think about when choosing presents for sick children, just to make sure that they're medically appropriate?
So one of the things that I often tell people is that you should go to the parents, right? We always say the parents are the experts on their children, and they can tell you the things, what not only what their kids like, but what's really appropriate for their children. Often a child with a terminal illness can have certain disabilities that may not allow them to enjoy certain toys or really interact properly with certain things. And what you don't want to do is give a child something that reminds them of their deficiencies, of the things that they can't do, because then that really kind of spoils the moment, spoils the happiness.
Right.
And so, in addition to talking to the parents, just be mindful, right? Be mindful of what a child can do. Be mindful of what they can't do, and make sure that whatever you're donating is something geared towards something that they can really interact with, participate with, and enjoy.
Now, I think this is really special. This gift donation also gives volunteers the opportunity to learn about the children. Can you tell us a little bit more about that and why was that important to include?
Sure. So, all our children are special, right? They all have their special journeys, their special stories. And we really think it's important that, anyone donating to the kids, like, really understands who the kids are, because, they're so valuable, right? Another thing that we deem important is just to make sure that, again, the donations that you're choosing, again, not only takes into account what a child can or cannot do, but also take into account that child's personality, take into account what makes that child, that individual so unique. And so that's really important to know.
All right, Dr. Taylor, thank you so much for joining us and sharing this really special effort just to make children, feel special during the holidays. We really appreciate it.
No, thank you for having us. We appreciate it.
To keep in touch with all the work that MJHS Health System does, go to their website at www.mjhs.org or follow them on social media across all platforms at MJHS01. We've come to the end of our show today. I'd like to thank all of our guests for joining us and the viewers for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at bronxnet.org. From our BronxNet family to yours, wishing you all a happy holidays. See you next time.